Top of the morning, ladies and gentlemen. Top of the morning. Just bear with me slowly. I might tongue twist some words because I've already smoked indica and my mouth dry, OGs. And so I will fuck up some English wording at the drop of a hat. Dog P. It ain't my original language. It was forced upon me. So, please, I am African in DNA. Jeez. First time I'm gonna talk about this. I share this with anybody. But I want to start off with a rest in peace to Dr. Leon Dvorsky from the old Soviet Republic. He worked out at Unity Outpatient Surgery Center with me. We were performing gastroenterology procedures endoscopically, along with vaginal reconstruction, vein stripping and litigation. The sweaty palms procedure was one of our number one procedures where we go in and we cauterize that sciatic nerve and shit, and that stops the sweaty palms. And we done a few more outpatient surgical procedures. It was an ambulatory surgical center, which means same day surgical procedures. But Dr. Leon Dvorsky from Russia, he didn't like my classmate Gilbert, that was Armenian, that worked out there with us. Every time I would check in to the OR, and Gilbert would be in there ready to scrub, and Dr. Leon Dvorsky would throw him straight out and say, "No, you get out of here. Mac is here. He from the hood." You know, they went through war shooting each other with AK-47s and stuff, so he understand what life is. That's what Dr. Leon Dvorsky would tell this other operating room technician, my co-worker and my classmate Gilbert. He was Armenian. Couldn't stand turkey. But then the Russian doctor couldn't stand his ass. So it was a trip. But anyway, Dr. Leon Dvorsky used to talk to me about his son on drugs and what can he do about it. I told him, well, you probably could start by limiting his funds, but since he born with a silver spoon, that ain't gonna stop Doc, because all his friends that he's acquired, the lifestyle that you give him, the area that you live in, drugs are still gonna be accessible to him. And so we would have this conversation doing colonoscopies mainly, removing polyps, tapeworms if we spot them, or checking for diverticulosis, see if they got the ticks, preparations in their lower colon, and whatnot. Colon cancer, we screening for. Send the samples in to pathology, the tissue samples that I take. And all that was going fine. But some of those gastroenterology procedures we were doing in colonoscopies were not needed on the patients. They were being scheduled by Dr. Rosenberg and Dr. Kim for extra money that they was finding through people they called scrapers. These people were from out of state. They would fly them there and fly them out after the procedure. So I knew something was fishy. But I was fresh out of school, so that's why I didn't get charged like they did at Unity Outpatient Surgery Center. Go read it. It made the news.